Let's now head into this live broadcast by bringing you the latest COVID-19 updates from the United States, where the pandemic continues to escalate, as the country has now recorded nearly 60,000 cases in the last 24 hours or so. The United States has reported more than 3.5 million COVID-19 cases, which means that nearly 1 out of every 100 Americans has now tested positive for this infection. Since the 4th of July weekend in the United States, the country has witnessed a resurgence of cases in the so-called Sun Belt in the U.S., which stretches across the south from Florida to California. The surge has led to some states reimposing stricter measures. California Governor Gavin Newsom has ordered the closure of indoor restaurants, bars, movie theaters, hair salons and places of worship. This move to curb the virus spread comes as cases escalate in the state. Hospital systems have also become strained in several California counties. On the other hand, Florida has now become the epicenter of the outbreak in the country. But even now, with the massive spike, Florida's Governor Ron DeSantis has refused to make mask wearing compulsory in public. Governor DeSantis, who has been slammed for his pandemic response, was even heckled during a news conference with the protesters screaming, "Shame on you."
You guys have no plan and you're doing nothing. Shame on you.
So at that time, when we had the, when we were here, we had a whole bunch of concerns.
Meanwhile, New York has become one of the states with the lowest infection rates in the country. New York also recorded 0 COVID-19 deaths yesterday. And for the first time since the pandemic broke out in the country, the state is now looking to reopen its schools, but remains wary of a surge. And schools reopening in New York come with strict guidelines and will only happen if the state's daily infection rate is below 5%.
Between August 1st and the day the school opens, we continue to monitor every day. And if the infection rate goes over 9, then we hit an emergency stop button. Okay? It's very simple. It's clear. Once you get a green light to reopen, then how you reopen, you follow the guidelines. And we leave it to the 700 school districts across the state to come up with the specific plan pursuant to those guidelines.
But even with the recent surge, U.S. President Donald Trump continues to attribute the spike to increasing testing. And Trump called testing a double-edged sword yet again, saying that when you test, you create cases. Listen in.
But no, we test more than anybody by far. And when you test, you create cases. So we've created cases. I can tell you some countries, they test when somebody walks into a hospital sick or walks into maybe a doctor's office, but usually a hospital. That's the testing they do, so they don't have cases, whereas we do. We have all of these cases, so, you know, it's a double-edged sword. At the same time, we have the lowest mortality, or just about the lowest mortality in the world.
For more details on the COVID-19 situation in the United States, Jagriti Dave is joining us live from Washington, D.C. Jagriti, thank you so much for joining us. Let's begin this discussion by talking about the COVID-19 situation in Florida and California. While Florida is recording a record surge, which is more than most countries even in the world, California seems to be reimposing sweeping restrictions. So what's going on, and what can this new surge be attributed to?
Yes, so we're seeing a huge increase in cases in states like Texas, Arizona and Florida. And in Florida, the governor there has put a pause on some of the reopenings, such as indoor drinking at bars, for example. But he has stopped short of a statewide mask-wearing mandate. In California, on the other hand, you are seeing a sharp increase in the number of cases. The number of daily cases has increased by about 20% compared to in the last week, and the deaths have risen up by more than 10%. And so this is really cause for concern, and there's a variety of reasons for this. Some of the cases, like in Texas and Arizona, officials there are saying that it's because these states reopened too soon, and there was this push to get the economy back up and running, if you remember. And in California, the governor there has said that there's, attributed this rise in to things such as people getting fatigued by the quarantine, not really adhering potentially to social distancing guidelines and mask wearing as stringently as maybe they should. But of course, some of these cases can be attributed to the fact that there is increasing testing happening, more testing happening now than there was, say, in April and March. But it's not just to do with the increase in testing. The number of positive test results are shooting up to such an extent that health officials say that it is because there is more to this than just an increase in the number of tests.
Right. I'd like to focus on New York for a bit. The infection rate in New York is coming down, and 0 deaths from COVID-19 were recorded recently. So are governors across the US seeking advice from the state of New York, which was once an epicenter and now seems to have curbed the infection rate?
Yes, it was quite extraordinary to think that back in March, New York was the epicenter, and just those awful death rates that we were seeing there. And the surge in cases that you're seeing in, say, in the Sun Belt, they're not necessarily the corresponding death rates that you saw, the similar levels of death rates that you saw in New York. But the surge in cases in Florida has definitely overshot that daily surge record that we saw in New York. And clearly, the governor of New York is proceeding with a great amount of caution. He is issuing very specific guidances on when schools can reopen, and states have to be in phase 4 in the state of New York in order for schools to be reopened. New York City is still in phase 3. Remember, now some states are clearly seeing that the path forward is the path of caution, which is something that health experts like Dr. Anthony Fauci are recommending. But there are, as we talked about, the governor of Florida is still not mandating statewide mask wearing. And so there are some concerns amongst health professionals that despite the surge in cases, the measures aren't being put in place, as we saw in New York and as we're seeing in other states. These measures are needed in places like Florida, and they're just not quite happening yet.
Right. Now, you mentioned the reopening of schools in New York, but the question remains, is this the right time? Because Andrew Cuomo even said that he'll put the brakes on everything if he sees cases rising in New York again. So what does the CDC say? Is this really the right time to open schools, as the COVID-19 situation in the US is still pretty grim?
It's a tightrope. I mean, the health experts agree broadly on the fact that children going into schools, physically attending schools, is important for a child's development, for young people to learn and to socialize effectively as part of their education and learning. However, the CDC is guiding that schools, if they do reopen, they have to enforce social distancing. They have to make sure that precautions are in place and that they can be done effectively to make sure that children are safe, but also to make sure that children do not pass the virus onto each other and they don't take it home with them and pass it on to maybe more vulnerable members of their families and their communities. And that is a real concern. And it's unclear whether schools are really able to do that, given they will need, there are many schools and health officials and education officials are saying they need increased personal protective equipment for teachers. They'll need increased hand sanitizers. All of this will cost money. And on top of this, schools are facing threats from the Trump administration of having federal funding withheld if they don't reopen by autumn. So it's really this balance that it's a huge challenge that schools are facing right now.
Right. My final question, since you had mentioned Dr. Fauci earlier. Now, the Trump administration seems to be on a collision course with Dr. Fauci. Why is the White House clashing with its top infectious disease expert amid a pandemic?
Well, it's been the tensions between the president and Dr. Anthony Fauci have been evident for some time. But over the weekend, reports were saying that the White House was seeking to discredit one of the US's top virus experts, epidemiologists. And they did this, according to these reports, by White House officials releasing a list of remarks that Dr. Anthony Fauci had made early on in the pandemic that they said that had proven to be incorrect in the end. And so this was the list that was given to outlets like the Washington Post and NBC News, where Dr. Fauci had said things such as there was no need to do anything differently than what ordinary Americans were doing at the time, no real need to change their behaviour, but also that the virus was not a major threat to Americans, and his recommendation in March that people didn't need to wear face masks. Of course, some of this changed, and Dr. Anthony Fauci said that these things could change, but this was something that the White House officials were saying to this list of things that Dr. Fauci had said were giving to these media outlets. And of course, Dr. Anthony Fauci last week had said to the Financial Times that he hadn't briefed the president for a couple of months. The president has said that he disagrees with Dr. Anthony Fauci on several occasions. Clearly, there have been growing tensions. He said that he's a nice man, Dr. Fauci, but he'd made a lot of mistakes in a Fox News interview, citing the fact that he disagreed with his ban on travel from China. But today, the Trump administration was trying to sort of downplay some of those tensions. That President Trump saying that I don't always agree with him. I have a very good relationship with Dr. Fauci. He's a very nice person. He did return Dr. Fauci to the White House to meet with the White House Chief of Staff, Mark Meadows. So it's clear that Dr. Anthony Fauci is, is here to stay for a bit longer. But these rifts arising, it's clear that the president sort of isn't, and the administration is not happy with Dr. Fauci's remarks, which disagree, which contradict the administration's sort of positive approach to how the country is handling the pandemic.
All right, Jagati, thank you so much for all your inputs on this story, and thank you for joining us.